Hello, my name is Dr. Randall Lindstrom, and I'm one of the chiropractors here at Atlantic Spine and Health Clinic. Today we're going to be going over an exercise called thoracic extension using a foam roller. This is a very aggressive mobility drill. It is something that we provide many of our patients after they've been here for several weeks and sometimes several months. This is an exercise that helps to mobilize the upper spine. Our previous video installment discussed a thoracic extension and shoulder mobility drill that was performed over top of a ball, something that we called IYTs and A's over a ball. Today this is going to be focusing simply on thoracic mobility and extensionability of that upper body, and we're going to do that over a very dense, hard foam roll. If at any time you perform this particular exercise and you feel sharp pain or discomfort that is beyond just kind of normal aches and pains, you need to stop and you need to make sure that you discuss the performance of this exercise with your primary care provider, or come see us to make sure that you're doing this correctly. So we're going to get started here. With this foam roll, the initial position that we want to set this is going to be right up underneath the shoulder blades so that it's in a good mid-back positioning. Okay. Some of the focal things that we're going to try to keep here is we want to make sure that when we extend backwards over top of this, we're going to try to keep our lower quadrant flat to the ground, try to make sure that we keep our back on the carpet or on the floor. Okay, we want to really try to prevent extension from that point as we go backwards. So we're going to fire our abdominals, kind of tuck our cheeks up underneath and try to keep that tucked up underneath a little bit. We're going to support our neck with our elbows close together, and then the rest of the exercise is a breathing exercise where we're going to exhale going backwards with the push coming from the arms, inhaling up and feeling like the arm is extending and doing the move for us, exhaling, really trying to feel like we're getting our head close down to the ground, again, without really extending from the neck because we have it supported in our hands, and without really extending from the low back, keeping that nice and stabilized and tucked up underneath. Again, so we can repeat these in a form of a breathing exercise where we exhale, inhale back to neutral, reset and tuck, exhale, and reset to neutral. Okay, performing some of these activities, you may hear some pops or cracks along the mid-back. That's okay as long as they feel comfortable. This can be performed again with repetition, and that's generally the way we like to see it. So we generally recommend that these are performed in stints of 30 to 40, maybe even 60 times in a day. Again, breathing, exhaling as you extend and extend backwards, and then inhaling back up to neutral and running through a repeat cycle there. We look forward to providing more information about any of these exercises. If you have any questions, you can reach us at AtlanticSpineClinic.com. You can also reach us on YouTube and see our webpage there. And you may also contact us at our office. Number here is 843-884-1876.